Here's a pretty cool case that we do not see on a day-to-day basis as foot and ankle providers. So this patient presented with approximately 4 to 5 months of lingering pain to the third toe. So if you look very closely, the base of the third toe here looks a little bit different compared to the other toes. So it turned out that there was actually a benign tumor within the base of that proximal phalanx of the third digit, and it turned out to be an enchondroma. So given the patient's persistent symptoms and discomfort, the decision was made to bring her to the operating room, and we created a window within the top part of the base of that big toe, the proximal phalanx, and an instrument called a curette was introduced, and we basically scooped the contents of the enchondroma out. Once the enchondroma is removed and curettaged and excised, it is packed with bone graft. Enchondromas are non-cancerous bone tumors that arise from cartilage cells. They are more frequently seen in the hand, and typically they are diagnosed as incidental findings when an X-ray is taken for another reason. While they can appear at any age, they are more frequently encountered in patients between the age of 10 and 20, and there seems to be an equal distribution between men and women. In most cases, treatment is not needed because they are not painful, but if they are painful or if the diagnosis is not certain, then typically advanced imaging can be considered. And if it is painful or if it has occurred in the setting of a what is known as pathologic fracture or an impending pathologic fracture, then the treatment is to remove the tumor, curettage or excision of the mass, and to pack it with bone graft. These benign tumors rarely transform into something cancerous or malignant. This is more likely to be the case when you see multiple enchondromas, and this is known as enchondromatosis. Some syndromes include Ollier's disease and Maffucci's syndrome.